The biggest thing about range of motion is decreasing pain and being able to decrease your pain and maintain your range of motion. Because if you don't have good shoulder motion, when you try to put your sleeve on and your arm goes up here and the caregiver's trying to help you and then you go, ah, the whole time, then that makes animosity within the family. You know, that everybody gets a little upset about that. But if you have had your range and you kept your range during that time, then you can get your sleeve on your shirt. You can keep your hand from being clawed and having those positions and get your fingers out straight. You know, and if you have, we live in Phoenix, Arizona, and if your hands get really hot and sweaty, you can get some breakdown in your hand from your hands being squeezed together all the time. So you want to be able to keep that motion. But if your fingers hurt and you put your hand into your sleeve and you cut your one little finger, I mean, it can send you another place. And a lot of people will have back pain or neck pain, and you have to be able to keep your range of motion and keep moving because you get kind of stiff and still. And so it kind of depends where you are within the system. You know, if your neck gets weaker and you're not giving it support, you need to make sure that you can look left and look right. You can lift it up and down. You know, if your head gets caught and it's weak and your head starts dropping and then you start looking up, because, you know, we want to look up. We want to be at eye level. So we get our head twisted this way, and then all of a sudden people are like, I can't get my head back up. I can't get into this position anymore. So again, equipment, we put cervical collars on people and different things just to help give them some support. Many people will get into a power wheelchair that tilts and reclines a little bit earlier just so they can have that place of their head can rest and they don't have to lose the range of motion on their neck. But it's important to keep your neck range of motion. Then once you're in, you know, many people who've come through have had back pain, neck pain a long time. Many people have had back surgeries because they thought it was a back surgery that would take care of that foot drop and those type of things, and that didn't happen. But they've had back pain, so they have to move their back. And if you're sitting in a chair all day, you're never doing any rotation, you're never doing any side bending, you're doing forward flexion and extension, but you're not getting any of that, and then your hips get where they don't move and roll, and you get stiff and sore, and then transfers get harder, and it just kind of combines. So it's important to do range of motion, at least check every day that you got it. And if you don't have it, it's letting someone help work with you. A lot of people won't let their spouses or caregiver help them. It'd be really nice if the caregivers and their people there who are their friends would take the time to do a little bit of range of motion with them and, you know, to ask them how it feels. Nothing should be painful when they range. That's not their job, to go get extra range and really pull on them or stretch them really hard. It's just that gentle movement that needs to be done and go from there.